Okay, welcome back to Clinician Voice, the podcast where we elevate the stories, insights, and leadership shaping the future of healthcare. And I'm your host, Dr. Robin Geiger. Very delighted today to have someone whose impact on nursing spans continents, disciplines, and generations, Dr. Adele Webb. Dr. Webb is an internationally recognized nurse leader, speaker, and scholar whose work has transformed global health practice, nursing education, and professional development. She has supported nursing initiatives across more than 40 countries, contributed to World Health Organization and CDC programs, published extensively on evidence-based practice, and currently serves as Executive Dean at Capella University, where she champions innovative pathways for nurses to advance their education and careers. And with that, truly honored to have you with us and a dear friend of mine, Dr. Adele Webb. Welcome.
Thank you so much, Dr. Geiger. And I'm excited to be here. I think this is a great opportunity to share some of the things that we feel strongly about and believe in. So thanks for the invitation.
Thank you for being here. Well, we'll get right into it then. My questions will just come right off the cusp, but there may be a few surprises in there for you. But I'm sure that you're up for the task, and I really appreciate your insight and just everything that you can share with our audience. So we'll get started with just, you've spoken extensively about global nursing leadership and professional advancement. What core message do you hope nurses take away from your public speaking engagements today?
Well, one thing I think is most important, and I think a lot of people don't pay attention to, is that the nursing care that we give, nursing as a profession here in the United States, is part of the globe. So when people talk about global nursing, often they think, oh, that's in Africa or that's in Europe or Asia, somewhere else. But global nursing is a part of what we do as well. And I think when we start to recognize that it's bigger than we are, we're going to make more advances and provide better care.
Oh, um, and thinking of that, and we've spoken at some of the same conferences. I definitely followed your footprint, and I appreciate your support. But when we speak and when you attend a conference in the United States or US, it doesn't mean that they're not attendees from other countries. And so you're right, just hearing that and sharing that, global definitely includes us is important. Um, you're a strong advocate for mentoring the next generation of nurses. What does effective mentorship look like to you? And how can leaders create that meaningful mentoring relationship at scale?
I think that we are always mentors, whether we realize it or not. So when you have some new nurses, new grads coming in, they're watching what you're doing, right? And they might mirror that in the care they give. So it's really important that we understand that we're leaders in what we're doing and we're being observed by people new to the profession. I th- I think it's really important that we reach out to younger nurses, and I mean younger, and help them understand their role and grow into being a mentor themselves. And I think that when you think about mentorship exactly, we have the responsibility to reach out. We're supposed to each replace ourselves, right? Because we have this staffing shortage. And I've done that like 4 times over. So I'm really proud of that. But I think part of the reason they're there is these are my grandchildren, is because I talked to them about nursing and I modeled what nursing could be. And I was very positive about the experience. So mentorship to me is just making sure people understand how important the role is, helping them along. It's not easy. We all know it's not easy, and there's difficult days and there's difficult times. Think about COVID, but helping people work through those and stay in the job. So it's a being there. It's an understanding what you have to give, not depleting yourself, but supporting somebody in their journey as they start along a trajectory, and who knows where they'll go, but give them that support.
Said it better. Um, I want to take this minute just to mention that we co-authored a mentorship course for Sigma International Nursing Society. And I just enjoyed working with you on that. And I'm hoping that others, if they're really interested in diving deep into mentorship and how it can support your team, just to maybe go over to Sigma and take a look at that course because it's there and I'm getting some really good feedback on that.
And then that was a great experience. And I think Sigma is a place, when you're in Sigma, you're already really at the level where you can be a mentor, right? And so to read that and understand what it entails and also how to be a mentee, I think those are really important skills that we need to impart. So I'm really happy that it's available.
And thanks for your work on that. Um, as we move forward, nursing continues to face major challenges. We've talked about burnout extensively. We've partnered on work with burnout with collaborative groups, and workplace violence is it's not going away. Definitely staffing shortages, persistent turnover. Which of these current issues do you feel is most pressing? Like what's most urgent? And how should academic institutions and healthcare systems work together to address it?
I think the most serious issue right now is workplace violence. And everywhere you look, you can just see the numbers are just exploding. Not just, patient family to provider, but also provider to provider, which is, I think, so disturbing. So
Right.
when you think about we don't have enough nurses and you think about retention and you think about burnout, how much of that is related to an experience of workplace violence? So I see workplace violence as kind of the umbrella that if we could address that, we could improve retention, we could attract more nurses, we could keep the nurses we have. Maybe they wouldn't burn out. When you look at the statistics, like 90% of nurses have either been a victim of or observed workplace violence. That's just not okay.
I agree. And, now they're afraid to speak up.
Mhm.
People are afraid to lose their jobs. They're afraid that, especially if they're represented in small numbers within their organization, they don't know what safety looks like. So I think that creating that ability to speak your mind or to speak up and share what challenges we're going through, that would be a great first step to dealing with workplace violence.
I agree. And I think because it's so widespread and such an issue, it's going to be baby steps to solve this. We can't just go in and say, okay, no more workplace violence. We have a policy. It just doesn't work that way. So it's really starting at the grassroots, looking at the root cause analysis and just taking little steps. And over time, those will start to blossom and improve. And hopefully, it'll never be gone completely.
Right.
And, I was an ER nurse for a long time and at a children's hospital. And so we had a lot of reactions from parents who've lost a child and they have to lash out at somebody, and you're there and you had the bad news for them. So, it's never going to be gone completely, but we have to teach nurses how to de-escalate
Mm.
about conflict resolution, how to protect themselves. And from an organizational standpoint, we have to provide those resources. We have to make sure that it's a safe place. Is there a panic button on your walkie-talkie or your phone that you carry around? Do people understand where they should stand in the room? You don't go all the way in the room and stand by the window and then you can't get out. All those kinds of things are so important. So from an
Right.
organizational standpoint, we have to address those. And then we also have to work with the schools. There was an actual
Mm.
quote, it was in the Akron Beacon Journal of May of 19, I think. A nurse had gotten beat up at the Cleveland Clinic, and that's in the article. And she said, it's expected you're going to get beat up from time to time. So I think, what are they teaching in the schools? Because I never expected that. And that's not all right. So we have a lot of work to do just across the gamut of all kinds of settings.
No, I agree. And even thinking of what does violence look like? There's psychological and physical
Mhm.
violence, right? And threats of violence. And it depends on the person and how they perceive it, how they receive that. So a lot of work to do. And, you mentioned that you were, weren't taught in school to expect violence. But, I remember not being taught in school to expect violence, but I remember the undertone is if someone's sick, anything could happen, but not how to prepare for that. And that was a little scary and a little challenging, especially during a code or
Oh, yeah.
during exactly or during times where the patient may have a diminished neurologic neurological disorder or diminished capacities. So yeah, we have a lot of work to do, a lot of additional training and support to give. Yeah, I agree with you. Thanks for sharing that.
Mhm.
Now you've been outspoken, I would say, really
Mhm.
in a great way about the importance of preparing nurses for leadership and advanced practice roles. It's necessary. What skills or mindsets do you believe are most essential for nurses entering a rapidly changing healthcare environment like ours?
And it is for sure rapidly changing, especially with AI and technology and the administration. So, what I really think happens is, and I've watched this happen so many times, people get promoted into leadership positions because they're a great nurse. But being a great nurse doesn't necessarily make a great leader. So we need to think about succession planning, take people who are interested and have potential, and help them develop the skills to lead teams, to, bring the people right. What do they say? Get the right people on the bus, but also how to get the wrong people off the bus, right? And
Right.
how to look at how do you work with teams for healthcare quality and safety and reclaim that leadership role. And what kind of leader do you want to be? There's so many different kinds of leaders. What kind of leader do you want to be? And I think the biggest gap is understanding finance.
Yeah.
Because even in master's programs, they're not
Mhm.
teaching finance. And one of the questions that comes up all the time when I'm talking is, how do you work within a budget? What does EBITDA mean? What are these terms? How does the fact that I open 4 catheters before I decide what size I'm going to use affect healthcare as a business?
Right.
So I just think it's so important that we start preparing what I think 1 million nurses are supposed to retire by 2030. And if you think their retirement age, you figure they've probably moved along, right? And they may
Mhm.
be leaders. So we're going to lose leaders. We need to make sure we're ready.
Yeah, couldn't agree more. Yeah, absolutely. And that leads into our next question about the shortage that we already have and what we're doing within academic institutions to really move and progress nurses through and how important it is during that time and during that early um, piece of their education for them to understand all of these different things. I know for sure that in my programs and the programs that I've either helped develop or I've worked as like an associate faculty, nothing about finance was there. And
Mhm.
it makes it difficult when nurses are going in not understanding finance, but also dosage calculation is not the only mathematical support that they need. So yeah, very important. Um, as we hear, and we're going to continue to hear about the nationwide shortage. Some people they don't think it's a shortage. They think nurses aren't assigned properly or they're not properly staffed. I think there's a shortage of faculty as well as nurses at the bedside. So, in regards to faculty, how can we work to remove some of those bottlenecks of accepting more students because there's not enough nursing faculty to support them? I mean, what do you think would motivate more nurses to choose faculty roles?
I think we need to pay them more. You leave a bedside job where you're making a certain amount of money, and okay, so you want to be an educator, and it might be a better schedule, right? More flexibility, but you could be taking a 20, $30,000 pay cut. People can't afford to do that. So there are a lot of people interested in being faculty, but they're just not able to because it's just not a fair pay scale.
Absolutely. And, not just, with regard to pay, what things are you seeing that are being done within academic institutions to retain the nursing faculty that are there? When you know that they're going to have, you know, if you're looking at their pay in relation to other nurses, it's going to be low. What's being done to keep them and motivate them into staying in those roles?
Well, there are a few things I see happening, and some of them have been going on for a long time. And so one of them is the flexibility that you get, especially let's say you're at the university level, you might have all summer off, and so you might be making less, but you have the summer off. I think one thing I see happening that I really like is a joint appointment. And that's, you can teach, but you have the flexibility. You can work a day or two a week and get paid for that. And I think why that's so important, because when I went through my undergraduate program, I had faculty that hadn't been at the bedside for a long time. And you could tell by how the information they gave you. Um, so I think allowing someone to keep their hand in clinically and work and augment what they're teaching can be a really important tool to attract people to education. And I think it brings a lot of validity to the job.
Yeah, that would be wonderful. I do recall when I was lead faculty that it was a requirement that I had to, have clinical, I had to remain at the bedside in some way or remain, engaging patients at least once a week. That was a requirement. So it was nice because, having my nurse practitioner license, I wanted to keep that up. So it also really supported me when I was working with those students, understanding what they were going through, having just seen a
Mhm.
patient myself. Not saying that you can't be great faculty without it. There's some great faculty who've only been
Mhm.
teaching, but it's nice to be able to have some faculty bring that piece in and share that knowledge, that thought leadership, and create that into thought leadership, I should say, for the rest of the team. So, absolutely.
Yeah,
Try.
oh, I'm sorry. When I was faculty early on, they wanted us to work, but it was on the weekends or night
Wow.
shift or afternoons. And so, when they start to say, okay, you're teaching these classes, but on Thursdays you can work clinically or something, it's a lot more attractive than having you work a full schedule and then do clinicals on the weekend.
I agree. Okay. Thinking back on some of your research and speaking topics, you focused on global health, evidence-based practice, and really elevating the nursing voice, which that platform we share. How do you see nurses stepping into more influential roles in policy and research and interdisciplinary leadership?
Well, one group I think is really important that they need to be a part of is Nurses on Boards Coalition. It gets, it's nobc.com, I think, but it's easy to find. It gives you the opportunities to submit your information and your interests. And when board positions come open, they match you with those. And I'm on the board of a hospital system, a large hospital system. And I hope I've contributed a lot, but I've learned so much. So I think that's something real important that they can do. The other thing is belonging to any professional organization. The American Nurses Association, huge advocate. Right now with what's going on is, are we a profession or a hobby? They're out there lobbying and making a big difference. And so I know it's hard to decide. So when I was a pediatric HIV nurse, do I belong to the HIV Association, the Pediatric Nursing Association, the American Nurses Association? So, when I think you have to make that kind of decision, I see ANA really as the flagship.
I agree. And then, honestly, start somewhere, I think is a really
Hmm.
good place to share. When I mentor others, I ask them where are your interests, or what are you least comfortable with?
Mm.
Maybe join that association and learn more. If it's leadership and you need that leadership training, join American Organization of Nursing leaders, or join one of the state. satellite
Mhm.
associations. Yes, but I think you have to start somewhere, and not being a part of an association, not sharing your voice. I think that it's such a disservice to yourself, the people that you work with, if they can't utilize your strong voice. You're a nurse, you have
Mhm.
such great insight after working with patients and education, or whatever area of nursing that you've chosen. So absolutely agree. um, you touched on this a little bit, and so I'm going to go back just a step and ask you, what are your thoughts on nursing as a profession and everything that's happening with Department of Education? How that information is being perceived and the impact that it may have on nurses in the future.
Well, I think it's really disturbing what's happening. I don't know what the outcome will be because I think in this political environment, a lot of things are threatened almost and they never come to fruition. So, I'm trying not to overreact to it, but
Mhm.
we've worked really hard and developed, and not just we stand on the shoulders of so many giants in nursing, and we've worked really hard to establish ourselves as a profession, and to have that be taken away in one sentence is just so disturbing. But I'm really hoping that with the people we have out there ringing the bell and, waving their hands, that people will come to their senses. I also know that politics is cyclical.
Mhm.
So in 3 years, we'll have a different leader and it'll be looked at differently and things could change. And so I find it really concerning, especially when we have a shortage and now younger people are hearing this and they may choose not to go into nursing. And you
Right.
know, I don't know. I know one day I'm going to be laying on a gurney looking up at a nurse, right? And I want this nurse to be someone who's a professional. And I think maybe some of our politicians have to think about that as well.
Oh, I agree. And I've said that so many times. I think maybe some of the my listeners would be like, "Oh, she's always saying that." But we will all be patients at some point in our life, at some time, and so it's important to understand healthcare, and to support, even advocate, whether you're a nurse or not. Advocating with nurses, aligning with nurses, and supporting them is really important. Um, no, I agree with you along those lines. And there's so much conversation out there, right? I don't know if you've seen some of the information on LinkedIn. And I'm trying to support all of those areas, where they're having those conversations about, some nurses say, this doesn't really mean anything about the profession. It's only, in regards to student loans. But honestly, I think once you go down that road,
Hmm.
that it opens it up for several other things. And nurses have to have licensures that we have to keep current. We have to have continuing education, certifications. It's not easy being a nurse. And honestly, one person said that their license says professional nurse, and I look back and mine does too. And so
Yeah,
it's
mine
just
does
like,
too.
yeah. So it's like,
Hmm.
maybe if the Department of Education does not mean or intend for it to be received that way, maybe they'll think about that, or work with someone to um, reword some of that information, and remove that if it's not something that they intend. So we'll see. I'm looking forward to hearing more about that, and fingers
Hmm.
crossed,
Me
because
too.
I think the biggest, you mentioned something that was huge. How does that look to students?
Hmm.
How does it look to high school students who are planning to go into nursing field? My son is one, and he was kind of disturbed by it. So
Hmm.
yeah,
Yeah.
it's far reaching. Absolutely.
It's very far reaching. And if they can't get the loans, how are we don't have enough now. And if they can't get the loans, how are we ever going to have enough nurses?
Right. That's a very good question. I know we're nearing our time here, but I would not want to end our conversation without asking you about, looking ahead, and, maybe what gives you hope about future of nursing profession. What message would you share with nurses who are feeling really discouraged about some of the information they're hearing, about some of the things that they're seeing in the field?
I think one thing I would share is that we have some great leaders out there. And if you look at just the professional organizations and leaders we have, and if you look at the American Academy of Nursing and their role in advocacy and supporting the profession, I think we have people who are really going to be able to make a difference, to stabilize this conversation, and to continue to move us forward, not just as a profession, but as a respected profession.
Wonderful. And, before I let you go, what advice a lot of your career has been surrounding education and academics. And I would love to know if you could address faculty. What advice would you share with nursing faculty that are out there also struggling to, keep keep to their profession and struggling to keep nursing students on this path to motivate them to actually go through and become a professional nurse?
Well, I think faculty have to understand how important they are because the nurses that graduate, just passing the NCLEX does not mean you're going to be a good nurse. So the mentoring you provide, the role modeling you do, the knowledge that you impart on these students is so important in their future. So you may have done these things and you may be where you are and real satisfied where you're at, where your career, but this is kind of where mentorship becomes important because all of these students are going to be you one day. And you want to make sure that you set the stage for them to be strong advocates for the profession, advocates for the patient, advocates for themselves. And so for faculty, I think that's the big charge. It's more than learning about blood gases. It's learning, it's being enculturated into being a nurse.
There you have it from our wonderful guest, Dr. Adele Webb. Thank you so much for sharing that message with nursing faculty. It actually resonated with me also as an associate faculty, so thank you for that. I really appreciate having you on the podcast, and thanks for all you're doing to advance nursing profession. Your work continues to inspire us all. Thank you.
Thank you. It was an honor. So I really appreciate being here. Have a good day.
Okay. Thank you. And to our listeners, we appreciate you joining us. We hope you'll join us next time on the Clinician Voice.